Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. As the West African Senior School Certificate Examination enters its third day, a student in Gombe State participates in the exams from Isolation Center. Tertiary schools students in Kwara State demand reopening of their institutions. And Pope Francis makes case for the poor, insists that COVID-19 vaccines must be available for them. Thank you for joining us on the program. At the onset of the COVID-19 pandemic, the WHO's message to countries was quite simple. Test, test, test. Well, it's been 5 months since that message, and countries have had to improve their capacity to try to stay ahead of the virus. Well, here in Nigeria, we have tested over 363,000 samples for COVID-19 so far. It is not where we ought to be, but it's far from where we were at the beginning. Well, an analysis of the numbers shows that 1 out of 10 has tested positive for COVID-19, as Nigeria's total confirmed cases stand at 49,895, with the addition of 410 new cases reported in the last 24 hours. 74% of Nigeria's total confirmed cases, that is 37,044, have been discharged. 24%. That is 11,870 remain active, while 2%, that's 981 people, have lost their lives to the virus. Here's a breakdown of the latest cases across 15 states and the FCT, with Lagos recording 210, FCT with 45, Ondo 30, Plateau 21, Edo 19, Ogun 16, Oyo 13, Nasarawa 12, Bauchi 11, Enugu 10, Kwara 7, Kaduna 6, Anambra 4, Ebonyi 3, Abia 2, and River State with 1 case. Well, there you see students of various government-owned higher institutions in Kwara State staging a protest, calling on the federal government to urgently reopen their campuses for learning. The representatives of various higher institutions in the state say if markets, airports and worship centers could be allowed to open, why deny the students their right to learn? Their long stay at home, according to them, is already having negative effects, with some set to be engaging in vices across the country.
It's very obvious that if we are being deceived, we should not deceive ourselves. It is only when we are in school that we can be regarded to as students. When we are outside, we are not students. Marketplace has been opened, airport has been opened, worship centers has been opened. Who are those people attending these places? Are they not students? It is when we go back to school that we will be regarded to as students. Now, when you keep saying education is the key, why then are you locking our schools? School have to be reopened so that we can know what next we have to do. Records are there. Everybody has started doing something that is unlawful, that is illegal. Students have started doing Yahoo and the likes. You get what I'm trying to say, sir? So why then don't you open our school so that those people that are going to market centers, worshiping places, can go back to school where they will be able to learn and provide lasting solutions to the virus that is affecting our lives? We are sending message via the Kwara State government to the federal government that our school has to be reopened.
Well, let's head over to Gombe State, where the government has been reviewing its COVID-19 response strategy so far, with a view to improve on it for better healthcare delivery. While presenting the 9th report to Governor Inuwa Yahaya, the state's task force on COVID-19 listed some of the milestones, to include the ramping up of tests with the equipping of and commissioning of its laboratory. Well, to boost the state's testing capacity even more, Governor Yahaya disclosed that 2 more PCR testing machines will be donated by TED Fund and Northeast Development Commission. Still in Gombe State, a senior secondary school student who tested positive for COVID-19 has been writing his examinations from the isolation center, writing his 3rd paper today. Well, now it appears more students will be joining him, as latest reports indicate that 7 more senior secondary school students have tested positive for COVID-19, and that follows a directive by the state governor to have all students under the exchange program tested for the virus. This is the Gombe State COVID-19 Isolation Center, a public health facility at the Gombe State Specialist Hospital. A medical officer and the State Commissioner for Education are getting ready with their PPEs for a special assignment.
I'm Honorable Commissioner for Education, Dr. Abdulahi. I've come to see that in the entry, I hope they are giving you your food, they are giving you, they are giving you your books, you are reading here.
The assignment is to oversee a senior secondary school student who tested positive for COVID-19, but has to write the examination at the isolation center where he's being managed.
For us to go in, because we are normal persons, we are not infected, so we must protect ourselves. So that's why we have to put on the personal protective equipment. This includes the headgear, the face shield, the face mask, then the PPE, and then the boots. Then when we go in there, we have to also observe social distancing. We don't go too close to him. We allow him, and we don't scare him. We just have to be very friendly, and we talk to him normally. Then we boost his morale, and we ask him to start his exam. Then the invigilator, who is the custodian, will brought out the question paper and presented to him. He now read the instructions, and we get the invigilator is still there now. He looked at the time and said, "You can now start."
7 more students have now tested for COVID-19 in Gombe State, and they will also be moved to this facility to write their examinations under close monitoring. Well, let's join Soji Billy Rose, who's a medical lab scientist, joining us from our Abuja studio this evening. Well, thank you for joining us on the program. Well, if you can hear me, Mr. Billy Rose, well, we've seen that schools have reopened, although safely, and we just saw in Gombe State that 7 more students, making it a total of 8, have tested positive for COVID-19. So worship centers have opened, schools are opening. From a lab scientist's perspective, have you been seeing maybe more tests coming in, more samples coming in as a result of opening or reopening the economy?
Oh yes. Of course, because the economy is being opened up, we are beginning to see more testing coming. For instance, if you look at the aviation industry, most of the aviation practitioners, I mean the flights, before you can take any of the foreign flights, you are requested to provide your COVID-19 test. Okay, so because of this, you find out that most people are now patronizing the labs, so that they can get their COVID-19 test, ahead of boarding time. So we are beginning to witness more testing. Really, most people are showing interest, and it's also part of requirement for some organizations for reopening. Just like we have in the aviation industry is actually taking testing more seriously. So we're beginning to see more patronage to the lab. Same also for the schools. Most of the institutions, like we advocated, we said government should support both private and public institutions, to ensure that the baseline tests of most of these students are taken, at the point of resumption, so that when they go back to school, we are able to segregate those who are positive and then isolate them sufficiently. And then we know that those people we are dealing with are those people who are seronegative for the COVID test. So most schools, especially the private schools, they are ensuring that their students are actually tested prior to resumption, which is something we actually advocated for, and I think this is the way to go. I want to encourage government to ensure that they support this. The state ministries of health, the Department of Public Health for each of the state, and of course FCT, should please support testing for schools, for students, when they are being engaged, because this will help us, control the rate and the spread of transmission among the students. But one good thing that we have is that, the COVID-19 transmission rate among these young ones, is a bit more limited. So we want to hope that we will witness less cases of increase, as it were, in the upsurge of this pandemic among the students.
We definitely hope so.
It's very important that we do testing, and I'm happy that both the aviation industry and the education industry, are actually making testing very, very important and focal and cardinal.
It's interesting you say that more cases, or at least more samples, are coming in to be tested. But we've seen that so far. We've just averaged about 3,000 tests per day. And here we have a capacity of way more than that. And speaking with experts, they will usually say that, well, the challenge is having people to come forward for testing. And that's why we're not doing as much as we ought to. But, I mean, you say that people are coming out for testing. So where is that challenge really as regards our testing in Nigeria?
Yes, those who are coming out for testing, basically, most of them, it is because testing is a requirement, for them to be able to get services like the aviation, like I mentioned. Most of the institutions also are insisting that, their students must test, their teachers must also test, and all those people who work, in their sectors must test before, they are allowed to resume operations, either in the aviation or in the school. So to that extent, yes, we are witnessing a few people coming forth for testing, but the truth is we are still under testing. And for me, having done an audit of the system, I think where the problem is basically now is not in whether we have the PCR equipment to be able to do testing, but it is at the level of sample collection. We need to decentralize sample collection. We need to engage more people, to be able to help us do testing. Just the way we're able to engage, a lot of laboratories, both public and today we have several private laboratories engaged in testing. So we also need to, if possible, outsource testing. Okay? NGOs, there are certain NGOs that have capacity, that have managed malaria programs, have managed HIV programs, they have managed, several programs within the health sector. We can give them funding and give them the mandate to help us, pull out more tests. Right. And then if you're able to decentralize testing, I tell you, we're going to have more cases, being tested. And then, of course, the number of tests we're able to do will, of course, increase. And then we have more people that we can isolate from the public and therefore reduce the spread of transmission. This is very, very important.
Right. Mr. Billy Rose, one more thing now. It's World Humanitarian Day, and health workers on the front line are being celebrated the world over. And it's not just doctors, nurses, even laboratory scientists are frontline, soldiers, as it were, in this fight against COVID-19. And if I could just ask you, if you could put a request out there, perhaps to the government or those in authority for our healthcare system for this fight against COVID-19, what would it be?
Honestly, what people are asking for is improved infrastructure so that they will be able to deliver services that they have been given mandate to do. The laboratory, for example, is in a state of decay in Nigeria. If you go to an average tertiary institution laboratory in this country, you will want to weep, prior to COVID. Of course, because of COVID, we're getting a lot of investment in terms of PCR and other instruments. But honestly, people want to give their best, but the environment is not there. We need to, apart from the issues of welfare, address the issues of infrastructure. The level of decay, infrastructural decay in the health sector is unacceptable. And that tells a story about why Nigeria is lowly ranked by WHO. The laboratory component that is supposed to support healthcare, is largely, left and underfunded. So if you give the health workers the right tools, to work, I think you will have made their day because they are trained to do this work. But most of the time, the facilities, the infrastructure to work is not there. Sometimes you see health workers agitating for better welfare. Right. Welfare will come second. When you have facility to work and you love your job and you are giving your best to humanity, there is nothing more gratifying than that. Government must muster the political will, must find resources to invest heavily in our health infrastructure. The laboratory must be supported. We need instruments to be able to practice at real advanced and tertiary level. Okay, we need instruments to be able to do, high tech. If we must be globally competitive, I tell you, we must up our game and scale up with respect to building the infrastructure level in this country.
Well, that's food for thought.
To remain where we are.
Right. Well, that's food for thought. But more importantly, food for action. I'd like to thank you so much, Mr. Soji Billy Rose, a medical laboratory scientist. Thank you for your time on the program.
Thank you for having me.
Well, the Catholic Pontiff has been speaking about another virus aside COVID-19. We'll tell you more about that when we return. Please stay with us. You're welcome back. Let's head over to Plateau State, where there is a backlog of over 3,000 pending results of samples sent for confirmation at the National Veterinary Research Institute in Jos, as the state records 1,857 positive cases of COVID-19. The Permanent Secretary in the Ministry of Health in the state, Dr. Azuwood Polycarp, says the non-functional laboratory at the NVRI has prompted the government to send samples to Abuja while the results are being awaited. He also observed that the increased number of positive cases are as a result of a rise in the number of tested people, as well as non-compliance to protocols.
We have one challenge, our testing center. They are not testing for now because of some problems that they're having. So we are taking our samples to Abuja for testing. So the testing center in Vom is currently now working on the samples that they had for the problem that they embarked on. But the new samples that we're taking them to Abuja for testing. We get results from Abuja. And then some of the pending samples that were not yet worked on because of the problems in the testing center in Vom. When they release their own results, we combine them together with that one. That's how you get very high numbers. The pending results that we're expecting is over 3,000.
Well, Dr. Alamin Dahiru is the president of Nigerian Medical Association in Germany. He joins us via Skype this evening. Thank you so much for joining us on the program, Dr. Dahiru. Now, I know that Germany has just recorded over 1,000 new cases, and I think that's the highest daily cases in about 3 months. That's a second wave, am I right? What is the cause of that?
Hello, thank you for having me. We can call it a second wave, but the cause of this problem is that after the cases were relaxed, the situation was relaxed and people were allowed to travel out. So most of the people go on holidays. It's summer already and people need to go on holidays. So they go to other European countries, and in these other European countries, there are so many contacts, there's no regulations, and people keep coming back. And 4 out of 5 patients been tested positive from this about 1,600 new cases are people who have traveled out of Germany. So I would say it's because of the relaxation of the movement.
So what can Nigeria learn from that? Because by the end of this month, we'll be opening our airspace to international travel. Well, for now, there's not much places you can travel to because of restrictions and what have you. But definitely that will change maybe in the coming weeks. So what lessons really can we learn from that?
Well, Nigeria can also learn through testing the patient, testing and retesting of patients before they travel and after they travel. On arrival, patients have to be tested. For example, in Germany, when you're coming back, you have to be tested. But this test, for example, is different. I don't know if in Nigeria it's paid, but in Germany it's free. So if you travel to an area where there's corona, so if you're coming back, the test will be free. And the compliance is also important, Self-isolation when you're coming back from an area of corona, the compliance of self-isolating yourself for at least 2 weeks is really important, So these are part of things that should help the Nigerian government. It's just to keep testing the patient, just keep testing and testing.
Right. Before we talk about this vaccine, conversation, I'd like to talk about adherence to, rules and protocols, COVID-19 protocols, where you are, and relating that to where we are right now, how we can learn from that. How has it been really, and what strategy is government employing to ensure that people adhere, at least, to those protocols?
Well, the most important thing is the compliance, and the compliance is adhering to these protocols. For example, in hospitals, you are not allowed to, you don't have visitors in hospital. If you are admitted in a hospital, you only give one name of anyone who will be allowed to come in and visit you. Secondly, if you are going to be admitted on an elective operation or any elective other things, apart from emergency cases, you have to come to the hospital, get tested, and then 48 hours, then you can be admitted into the hospital. There is compliance problem. For example, there will be, at the end of this month, around the end of August, there will be a demonstration in Berlin because the people are even tired of wearing the mask and everything. So, yeah.
Well, clearly that's a challenge around the world, but I'd like to thank you so much, Dr. Al-Amin Dahiru, the president of NMA in Germany. Thank you for your thoughts this evening.
Well, thank you. Thank you for having me.
Well, still on the global space, Pope Francis has waded into the global vaccine race for the coronavirus with a call for the world's poor to have access. That's if one becomes available. Speaking to a general audience from St. Peter's Basilica, he said it will be sad if access to a COVID-19 vaccine was made a priority for the richest. And he said it will be sad if the vaccine became priority of such and such nation and not universal for everyone. He also spoke about social injustice virus.
Including one here in the port of Denia.
In other parts of the world, Spain has issued orders for an outdoor smoking ban, nightclubs to shut, and a curfew on bars and restaurants to help slow the spread of COVID-19. Now, all restaurants and bars must close by 1 a.m., with no one being allowed to enter after midnight. In the U.S. state of Wisconsin, the coronavirus has not stopped Republican supporters from campaigning for the president. Some have been wearing face masks while doing so, but many do not, despite rising cases in the state, as well as the governor's orders to campaign indoors. Britain plans to bring in regular population-wide testing for COVID-19 to suppress the spread of the virus and limit restrictions that have crippled one of the worst-hit countries in the world. Health Secretary Matt Hancock says the government would expand a testing study from 28,000 people now to 150,000 people by October, and ultimately 400,000 to help establish a better national picture of the pandemic and spot local outbreaks. The people in Hong Kong say a new round of relief measures introduced by the government will boost confidence and have positive impacts on epidemic prevention and control. Chief Executive Carrie Lam announced the decision at a press briefing ahead of an Executive Council meeting that the region would roll out the third round of relief measures to mitigate impact of the continued COVID-19 epidemic on the economy. Finally, Colombia has resumed domestic flights after a break of 5 months as the South American country relaxes restrictions aimed at curbing the spread of the coronavirus. The International Jose Maria Cordova Airport reopened for flights. The president says it's an important step for reactivation of the economy.
Well, on this day 6 years ago, Nigeria was battling a different yet deadly virus, the Ebola virus disease. It was in the thick of this battle on August the 19th, 2014, that Nigeria lost an Amazon, Dr. Stella Adadevo, who had raised the alarm while treating the index case Patrick Sawyer and ensured that he was not allowed out of the hospital's vicinity. Her heroic act curbed the spread of the deadly virus, helping Nigeria to successfully contain the viral hemorrhagic fever that has ravaged other African countries, leading to thousands of fatalities. A nurse, Obiye Jelonu, and a hospital maid, Mrs. Uko, also lost their lives while caring for the index case. Well, let's take a look at our website, channelstv.com, where you can get access to all important stories across business, sports, politics, of course, the COVID-19 pandemic update, and other areas. Channelstv.com is a place to be. Well, thank you for watching the program this evening. I am Kayode Kikiolu. Do stay safe.